Good evening. During our house meetings this fall, we heard dozens of stories of people fighting a drug addiction. Our drug committee, including people from your congregation, have had over 30 research meetings with professionals in this field. These meetings have confirmed that drug addiction is killing our friends and our family. Through our research, we learned that 80% of people who are currently addicted to heroin was prescribed pain medication. Kentucky has passed new laws to limit pain pills in the hope of curbing new addictions from starting, but the people who already are addicted are struggling to stay alive. Fayette County is number 2 in the state for heroin-related overdose deaths. In 2013, 81 people died from overdoses, and 162 people died in 2016. Overdoses have doubled. The fire department has used 2,376 doses of life-saving drug called Narcan in 2016. Without Narcan, even more people would have been dead. And these overdoses are incredibly expensive. Visits to the emergency room from overdoses between 2016 and 2017 cost over $2.3 million. A study from the American Enterprise Institute estimates that the opioid crisis cost each person in Kentucky $2,412 in 2015 alone. We need a solution that will save lives and save money. But there is also another deadly aspect to drug addiction. When people reuse dirty needles, they catch other diseases. One of those diseases is hepatitis C. There were 757 cases of hepatitis C related to drug abuse in Fayette County between 2016 and 2017. The other disease is HIV. And according to the Centers for Disease Control, Kentucky is at risk for an HIV outbreak. So here to share her story is Angie Allen from Mary Queen.
Good evening. I'd like to tell you about my brother, Danny. Danny had dazzling blue eyes, a charming smile, a quirky laugh, an adventurous spirit, and he used to humor and amaze me as a child with his talent of doing flips in the air at his little sister's command. It seemed those priceless days were cut short. For in middle school, Danny was introduced to drugs and began using. Danny was introduced to drugs, and everything changed. In his 20s, his drug addiction progressed to the use of heroin and cocaine. He was in and out of rehabilitation numerous times and faced multiple incarcerations. Years passed, and I regretted that his drug life had taken us so far apart. In the last year of Danny's life, he was on the road to recovery. Danny and I were able to reconnect. But years of untreated hepatitis C caused liver cancer. And he died just 2 months ago, on March 6th, at age 58. If there had been a needle exchange program, he might still be here today. Danny was a bricklayer by trade. He once said, "I want all of my work to be a masterpiece." Like everyone, he aspired to do good and make a difference. Unfortunately, My brother's children are also now suffering from drug addiction. I want them to have a chance to live out their lives. Every life is an irreplaceable gift to this world. An expanded needle exchange program will save the lives of drug users and will give them a chance to live long and productive lives.
The director of the Kentucky Office of Drug Control Policy, Van Ingram, has told us there are only two things we can do for people who are addicted to drugs. The first one is to keep them alive, and the second is to get them treatment. Every human life is valuable. Recovery is a continuum, and if you can't stay alive, then you can't move ahead to the next level of recovery. We need a solution that will enable recovery, save lives, and save money. Needle exchange programs reduce the spread of disease by providing clean needles and a safe place to dispose of dirty needles. This saves lives. People who go to needle exchange programs are 5 times more likely to enter treatment. Let me say that again. People who go to needle exchange programs are 5 times more likely to enter treatment. This enables recovery. For every $1 to $2 spent on strategies like needle exchange, $5 to $7 is saved in healthcare costs. Obviously, this saves money. Based on our research, the needle exchange programs that get the most people into treatment meet the following criteria. They offer a variety of days, hours, and locations, provide as many needles as a person needs for the week, and have trained staff and peer support specialists. Lexington has a needle exchange program, but it does not follow these best practices. It has limited hours, being open only 8 hours a week. There are no evening or weekend hours. There is only one location. Not all staff are trained to deal with addiction, and there are no peer support specialists. Last Wednesday, we had a meeting with Dr. Craig Humbaugh, the director of the Public Health Department. We presented our proposal for him to work with us in developing a comprehensive plan to improve the local needle exchange program. We would like to see the plan include, first, consulting with the National Harm Reduction Coalition. Second, offering evening and/or weekend hours and alternative locations as determined by current drug users. Third, strengthening access to treatment by having drug and alcohol counselors and peer support specialists. And fourth, securing dedicated treatment slots for people who use the needle exchange. So where is Dr. Humbaugh?
Dr. Humbaugh is out of town. We've already met with him twice, and we're going to meet with him again on May 23rd. It's not clear yet if he will strengthen the needle exchange program with these specific points, but we are committed to future conversations concerning the development of plans for needle exchange. This is an important first step, but it will take a lot of sustained power and persistence on our part to see this happen. There's prejudice in our community against people who are addicted to drugs, and there's a myth that needle exchange encourages drug use. Hard data says this is not true. Further, Bishop John Stowe of the Catholic Diocese of Lexington has said needle exchange programs prevent disease and death among an already vulnerable population. We're concerned that the health department has bought into this false and fear-filled mythology about needle exchange. But we know, as people of faith, that we have a responsibility to speak truth, to serve as examples to Greater Lexington, to push for solutions that reach out especially to the most outcast and vulnerable people. Needle exchange programs are making a positive difference in the lives of those affected by substance abuse disorders. Needle exchange programs save lives and get people into recovery. Over time, we'll have to use our power to get officials to confront this prejudice and invest in this important program. So what will we do? We'll rise up and